still going on about China, Wuhan, EcoHealth Alliance, the funding of gain of function research. We've been told now for 5 years that China was ground zero for the deadliest global pandemic in a century. Lives were destroyed, businesses shut down, freedoms were permanently erased. But now Beijing is saying, actually, it was America's fault all along. Seriously, that's the claim. This isn't some throwaway line on social media or a random op-ed. It is the official position of the Chinese government. They just published this month, just recently, in a formal white paper from the State Council Information Office, Beijing's version of a press secretary meets Ministry of Truth. This document is titled COVID-19 Prevention, Control, and Origins Tracing, China's Actions and Stance. Okay. And in it, China says plainly, quote, COVID-19 may have emerged in the U.S. earlier than the U.S. official timeline and earlier than the outbreak in China. Now, maybe that sounds absurd, maybe it doesn't, but what's remarkable is the level of detail China goes into as they lay out their case. They're not just throwing out accusations, they cite U.S. government data, early blood samples, CDC studies, and even animal surveillance reports from the USDA. This isn't a tweet storm, it's 70 pages of footnoted data. So let's break it down. The first claim they make is COVID may have been circulating in the U.S. months before Wuhan. So according to the paper, in the summer and fall of 2019, Virginia reported 19 outbreaks of respiratory illness. That's normal flu season, you might say, right? Well, no, but not quite. China says, quote, laboratory tests were unable to identify the causes of some cases, which local media suspected to be a mystery virus, unquote. They also point to the vape lung outbreak. If you remember this, in 2019, people started turning up at hospitals with mysterious respiratory failure. They were coughing, they had fever, shortness of breath. Hundreds were hospitalized, dozens died. At the time, the CDC said it was linked to vaping, but China now claims, quote, the symptoms were highly similar to those of COVID-19, unquote. So were those early COVID cases misdiagnosed? Well, we don't know, but here's what makes it interesting. China is using our own data to make their argument, okay? Here's their second claim. Early antibody evidence in the U.S. shows COVID was circulating in the U.S. as early as December of 2019. So in a 2021 CDC study of blood samples from December of 2019 to January of 2020, over 100 came back positive for SARS-CoV-2 antibodies. Now, that was before anyone in America was officially diagnosed. Then there's the NIH's All of Us study in a blood that was collected in January of 2020. They found that COVID antibodies, they found the COVID antibodies in samples from Illinois and Massachusetts. These samples were drawn before these states had any confirmed cases at all. So China sums it up like this, quote, SARS-CoV-2 was circulating across the U.S. at a low level as early as December 2019, well before the first official cases were recorded. Now, does this prove the virus started in America? No, but it does raise the question, if the virus was already here in December before Wuhan even locked down, then why were we so sure that they were the source, right? Okay, so claim number 3, Fort Detrick. This is the nuclear option, okay? Fort Detrick, Maryland. That's the site of the U.S. Army Medical Research Institute of Infectious Diseases. It's where we handle Ebola, anthrax, and coronaviruses. In July of 2019, the lab was abruptly shut down by the CDC over safety violations involving containment protocols. China's white paper asks bluntly, quote, what were the real reasons for the shutdown of the Fort Detrick Biological Laboratory? The U.S. owes the world an explanation, unquote. Yeah, that's not very subtle. That's a direct suggestion that the virus may have come from our own lab and that it wasn't reported or maybe wasn't even noticed until it was too late. They're also asking questions about research at the University of North Carolina, where between 2015 and 2020, 28 lab incidents involving genetically modified microorganisms were reported to the NIH, 6 of them involving engineered coronaviruses. Now, if that sounds like a stretch, keep in mind, this is exactly what the U.S. said about China, that Wuhan scientists were studying bat coronaviruses and may have accidentally let one escape. So if it's a valid question when it's aimed at them, then why would it be illegitimate when it is then aimed back at us? Okay, looking at their fourth claim, the paper also dismantles the wet market theory. Remember the early narrative that the virus jumped from a bat at a seafood stall in Wuhan? Well, China now says that's not likely. Their own CDC, according to the report, tested 457 animal samples from the wet market. What was the result? Quote, all tested negative for SARS-CoV-2. Instead, they found the virus on environmental surfaces and argue the likely source was viral shedding from infected humans, not animals, meaning someone brought it there. So where did that someone get it? China suggests cold chain transportation, that is imported frozen food from abroad. So in their words, they say in this white paper, quote, viable virus from cold chain food packaging was successfully isolated and cultured. So in other words, maybe the virus came in on a box of frozen seafood from outside of China. Now, that might sound bizarre, but again, they're citing peer-reviewed studies. In 2020, 2 dock workers in Qingdao tested positive for COVID despite no travel or contact with other cases. They'd handled imported frozen food. The packaging tested positive and the virus was isolated. Now, that doesn't prove anything, but it raises a serious scientific question. Is it possible the first outbreak was sparked by a virus brought in, not created or leaked from a lab there? And more to the point, why has no one in the West asked these questions seriously, right? I mean, that's the big question here. This white paper also doesn't stop at the origins of the virus. The paper also, like I said, it's 70 pages long. It also criticizes the U.S.'s COVID response, calling it the worst of all the countries, a weak link in global public health governance. They point out that China's life expectancy increased during the pandemic from 77.3 to 78.6, while U.S. life expectancy dropped from 78.8 to 76.1. They note that China shared more data, hosted more WHO visits, and sent more vaccines abroad than any other country, including to the United States. And by the way, their vaccines did not have mRNA. Their vaccines were actually the classic, typical, attenuated live virus vaccines, or they might have even been kind of like the culture, like dead virus vaccines, but that expose you kind of like the normal stuff, not these other wonky things that we did with our vaccines.